The sudden onset of diplopia, or double vision, in an adult is an important symptom which may indicate serious disease. Here are a few pointers. It is first of all important to establish if the double vision is coming from just one eye or from both. If double vision persists if one eye is covered, then the diplopia is uniocular and the cause can be found within the eye, such as a developing cataract. If double vision is only present when both eyes are open, then it is binocular. It is also important to determine if there are any other symptoms, for example, pain or weakness of other parts of the face or mouth, that may help indicate the diagnosis. As always, a full medical history should be taken. The main cause of binocular diplopia is reduced action of one of the extraocular muscles. This may be due to an abnormality of the muscles themselves, such as thyroid eye disease, or the neuromuscular junction, as in myasthenia gravis. More usually, it's due to interference with the nerve supply to the muscles. Causes for this include vascular occlusions of the blood supply to the nerves, such as in hypertension or diabetes, or direct compression of the nerves by intracranial tumors, trauma, or raised intracranial pressure. Interference with the oculomotor connections within the brain, for example an internuclear ophthalmoplegia, are less common. Some of these underlying problems will be evident by taking a careful history. It is particularly necessary to take a detailed medical history, as this may reveal underlying conditions associated with the cause of the problem, such as diabetes or hypertension. A blood pressure measurement and blood glucose assessment should always be part of the assessment of an adult with diplopia. Examination of the eye movements will reveal the cause of the diplopia, but look for other signs around the eye too. The position of the lids and the size of the pupils and any other abnormalities that may suggest that other cranial nerves are damaged. For example, in a sixth nerve palsy, when the lateral rectus muscle is affected, abduction is reduced or absent. Diplopia, horizontal in the case of a sixth nerve palsy, is most marked when abduction is attempted. In a third nerve palsy, the superior, medial, and inferior rectus and inferior oblique muscles are affected, and the eye is abducted and depressed due to the unopposed actions of the lateral rectus and superior oblique muscles. Ptosis may be present and the pupil may be dilated. A painful third nerve palsy with the pupil dilated may indicate an aneurysm of one of the blood vessels within the brain and requires urgent treatment. This may sometimes be the case in the absence of pain too. Clues as to the cause of the diplopia may be revealed on ophthalmic examination. Diabetic or hypertensive retinopathy may be present. Examination of the discs may reveal papilledema caused by raised intracranial pressure. All patients with diplopia need a full medical and neurological assessment to establish the cause. Sudden diplopia is a serious condition.